What does the public think about chiropractic? The 2015 Gallup survey. In 2015, Palmer commissioned the Gallup organization to survey nationally to determine attitudes and perceptions about the chiropractic profession. Although there have been attempts in the past, this survey approach has some unique aspects which we will review. There are two publications, one published in JMPT in 2015, and the complete survey available at the palmer.edu website. The title of the JMPT article is Public Perceptions of Doctors of Chiropractic, Results of a National Survey and Examination of Variation According to Respondents' Likelihood to Use Chiropractic, Experience with Chiropractic, and Chiropractic Supply in Local Healthcare Markets. And the whole report is available as Gallup Palmer College of Chiropractic Inaugural Report, Americans' Perceptions of Chiropractic. It's hard to do justice to such an extensive survey with a short video review, so please access these two publications to get a better sense of how questions were worded and for more data and analysis. Links to these publications can be found on the home page of this video. So why now? Over the last 5 years or so, significant changes in the medical recognition of the value of chiropractic care has occurred, including the American College of Physicians and the American Pain Society, as well as the Task Force of Neck Pain and its Associated Disorders, recommending spinal manipulation for the treatment of certain spinal pain conditions. There's an increased staffing of DoD and VA facilities with chiropractors. Most major sports teams have a chiropractor, and corporate America is exponentially staffing their healthcare facilities with chiropractors. Changes in healthcare delivery since the Affordable Care Act have also had effects. So has this affected public opinion and utilization? Specifically, the purpose of this study was to determine whether general perceptions of DCs varied according to likeliness to use chiropractic care, whether particular demographic characteristics were associated with chiropractic use, and whether perception of DCs varied according to per capita supply of DCs in local healthcare markets. So, what do we know about the utilization rates for chiropractic? Historically, we have a good sense. A literature review examining studies published between 1965 and 2005 found that the prevalence of chiropractic care use varied between 6% and 12%. The National Health Interview Study found that the prevalence of chiropractic care use among U.S. adults remained relatively stable for the years 2002 through 2012. It was between 7.5% and 8.6%. And the Medical Expenditure Panel Survey, MEPS, which includes a household survey, review of healthcare provider records, and insurance utilization records, has measured utilization from 1980 through 2008. They found that 5.1% of U.S. adults in 1980 utilized chiropractic care, with a doubling of that rate in 1988. Then more recently, the MEPS survey indicated that of U.S. adults, the following percentage used a doctor of chiropractic. In 1997, 3.7%. In 2006, 5.6%. And in 2008, 5.2%. Keep these numbers in mind when we review utilization rates from the current Gallup survey. So who was surveyed? This was a nationally representative survey of 5,422 members of the Gallup panel conducted in the spring of 2015. Respondents could either use a web-based portal, of which 95% did, or a mail-in survey where only 5% did. The response rate was 28.7%. The survey compared respondents' demographics, including age, sex, employment status, income, perceptions of DCs, and chiropractic care based on their actual experience with DCs. Respondents were assigned into one of four groups: those who had been to a chiropractor as a patient within the last 12 months, recent users; within the past 5 years, but not within the last 12 months; more than 5 years ago, and never. Then creating groups for comparison, responses to two questions generated four groups: expected to use a DC, likely to use a DC, unlikely to use a DC and highly unlikely to use a DC. For the expected to use a DC group, there was a combination of 1,398 respondents who said that they would choose to see a DC if they were experiencing neck or back pain and wanted to see a healthcare provider, with the 324 respondents who indicated that they would be very likely to use a DC. The results? Only 29% of respondents indicated that a DC would be their first choice for treatment of neck or back pain. This might be influenced by the perception that they would need a referral from their MD first. So who would they see? 54% would see an MD first, but only 6% would see a physical therapist, 7% a manual therapist, and only 1% an acupuncturist. The good news? 61.4% of respondents believed that chiropractic care was effective at treating neck and back pain. And 52.6% thought DCs were trustworthy. That seemed influenced by how recently they had seen a chiropractor. And a significant increase in utilization was seen, with 14% of respondents indicating that they had seen a DC within the last 12 months, a dramatic increase from past measures. Another 12% indicated that they had seen a DC within the last 5 years. However, 49.4% of survey respondents indicated that they had never seen a DC. What were the demographic findings? Some interesting but perhaps mainly statistically significant findings were that whites see chiropractors more than other groups, women were a bit more likely to use chiropractic care than men. About 2/3 of adults less than 35 years old had never seen a chiropractor. Utilization rates were about 11 visits annually for the prior 12 months. And those respondents ages 50 to 64, whose incomes were between $50,000 and $100,000, visit the chiropractor less frequently. Some perceptions were that 40.8% agreed or strongly agreed that they wanted to use a DC only for treatment of neck or back pain. Only 9.5% wanted a DC to be the first healthcare provider that they talked to about their health, and only 21.4% wanted to talk to a DC about general health and wellness issues. So what were the reasons why individuals don't seek chiropractic? Well, potentially because they were discouraged by someone they know, were unsure about how much training chiropractors had, were unsure of the risk, felt that the cost was too high, and didn't know if their insurance covers chiropractic. 24.2% of respondents agreed or strongly agreed that chiropractic care was dangerous. 43.6% of respondents agreed or strongly agreed that it required too many visits, and 42.7% thought that it was too expensive. Surprisingly, not many adults report having been discouraged by a healthcare provider. For a medical doctor, 13%, a nurse, 6%, and a physical therapist, 7%. However, 29% have had a family member or friend discourage them from chiropractic care. Only 15% of adults answered that students need 7 or more years of education after high school to become a chiropractor. Nearly half think that chiropractors need only 4 to 6 years of education after high school. You will recall that at least 3 years of college plus 4 years of chiropractic college are required by CCE. Almost half of respondents did not know whether chiropractic was covered under their insurance. Almost 40% of DC users whose insurance does cover chiropractic still report that expense is a barrier to higher utilization. So, what might be some conclusions drawn from the results of this survey regarding increasing the utilization of chiropractic care? Well, familiarity with chiropractic seems associated with increased trust and perceived knowledge of what DCs do. Increasing the supply of DCs in areas of low per capita supply might increase patients' likelihood to use DCs to treat neck and back pain. And increasing awareness of chiropractic education may increase a sense of trust and decrease the perception of risk. The future? It will be interesting to follow this survey over time, given Palmer College intends to make this an annual survey. They also intend to learn from the survey and use review and analysis to determine how future questions will be worded and which questions will be asked. It will be important to map any trends or changes in trends to any intentional profession-wide attempts to address the findings of the current survey. We can do better, but this requires a profession-wide push to change public perceptions.